Okay, we're now going to run through actual drawing up of the syringe, the medication in the syringe, and then popping it into the driver pump. I'm just going to use some hand sanitizer, clean my hands first. Okay, so as I said earlier, we're going to use a safety intimer device that will be put into the patient. I'll show you that in a moment. We're using a 20ml Luolock syringe. Our type are Omnifix, but there are several others available. As long as they're a Luolock type, that's fine. We've got a clear dressing. Ours is a Tegaderm 3M type, so that you can pop this dressing over but still see where the actual intimer is entering the skin. We've got our giving set. And this is an anti-siphon device, and you need to prime this line before it's connected to the patient. I'll show you how to do that. We have a 9-volt battery to use in the pump itself, a label for the syringe. On the label you have the patient's name, the drugs used, the amount of drug and the batch numbers, the person who prepared it, and the time and date. We need water for injection. For the purpose of the training video, we're just going to prime this syringe with water. Obviously you would be using, for example, morphine or midazolam in a syringe driver, but usually whatever you're using, you do add water to make it up to 17 mils in total volume, to allow 3 mils to prime the giving set. And I've just got a needle, and I've got a wipe to wipe the patient's skin. Back to the pump. I'm just going to put the battery in first of all, and then I'll show you how to turn it on. There's guidance inside the battery casing, so you just pop your battery in, put your cover back over. Then we can turn the pump on, and it's this button here to the left hand side. It'll make a noise, and then we can see on the screen here, it's telling us on this little display screen to load our syringe. I'm now going to put some gloves on. It's good practice to wear gloves when you're drawing up any medication. I'm just going to open the water, ready. As I said earlier, you would have your drugs checked out and ready to draw into your syringe. Try not to touch the end of your syringe, because that's obviously sterile. And likewise the end, the needle part, avoid touching them. You can now connect it. And we can draw up our drugs, or water in this case. So I'm drawing up to 17 mils, and that will allow 3 mils to prime the line. Okay. Get rid of the sharp. Now we can attach the syringe to the giving set. Again, trying not to touch the sterile parts. Don't want to contaminate anything. And then we can prime the line through. The syringe is there telling us that it's been paused too long, so we'll just press yes to confirm. That's our line ready. And I'm now going to attach it to the safety intimer. So we also need to prime this part through as well with our medication. Okay, turn that part off. On the intimer you have a port here. Just remove the plastic cap and connect. Once you're happy that it's connected, you can just gently prime that through, and you will see a little flashback at the end there when you've primed. That's it, I'm happy with that. Also in the tray I've got ready a wipe for the patient's skin and a dressing.